Medical Assistant Practice Test for Clinical Competency 2026, 50 questions with explained answers. Question 1. Which of the following measures is a normal specific gravity of urine? A. 1.000, B. 1.025, C. 1.050, or D. 1.125. The correct answer is B. 1.025. Urine-specific gravity measures the concentration of all chemical particles in the urine. A normal range is typically between 1.005 and 1.030. 1.025 indicates a normal concentration. Question 2. Which of the following is a disposable glass or plastic tube used for hematocrit determination? A. Micro-collection tube, B. Capillary tube, C. Reagent tube, or D. Serum separator tube. The correct answer is B. Capillary tube. Capillary tubes are thin, hollow tubes used to collect small blood samples via capillary action, commonly used for microhematocrit testing to measure the volume percentage of red blood cells. Question 3. Which route of temperature assessment is least invasive? A. Intranasal, B. Oral, C. Rectal, or D. Temporal. The correct answer is D. Temporal. The temporal artery thermometer measures the temperature of the blood flowing through the temporal artery by scanning the forehead, making it non-invasive and highly accurate. Question 4. The ratio for making a disinfectant from bleach and water is A. 1:5, B. 1:10, C. 1:20, or D. 10:1. The correct answer is B. 1:10. A 1:10 dilution of household bleach, sodium hypochlorite, in water is the standard recommended concentration for surface disinfection of bloodborne pathogens in a medical setting. Question 5. To screen for hearing acuity or bone conduction of sound, the medical assistant would use A. Otoscope, B. Ophthalmoscope, C. Tuning fork, or D. Snellen test. The correct answer is C. Tuning fork. A tuning fork is a metal instrument used to test hearing acuity by air and bone conduction, Weber and Rinne tests, and to check for neurological vibratory sense. Question 6. Which of the following is not considered proper patient instruction for obtaining a clean catch midstream urine specimen? A. Have the patient remove undergarments, B. Make sure not to touch the inside of the container, C. Continue to hold the labia apart and void a small amount into the toilet, or D. Clean the urinary meatus from back to front. The correct answer is D. Clean the urinary meatus from back to front. When performing a clean catch midstream collection, the patient should always clean the urinary meatus from front to back to prevent introducing bacteria from the anal area into the sample. Question 7. Upon discovering a known diabetic patient who is disoriented and confused, which of the following should the medical assistant do first? A. Check the vital signs, B. Give a form of glucose to the patient, C. Draw blood glucose, or D. Check for spontaneous respirations. The correct answer is B. Give a form of glucose to the patient. In a conscious but disoriented diabetic patient, hypoglycemia is the most immediate life-threatening concern. Giving a quick-acting glucose source can prevent further neurological decline or coma. Question 8. A procedure that a medical assistant would not expect to take part in when doing minor surgeries in the office is A. Suture of lacerations, B. Biopsy of the lung, C. Cyst removal, or D. Biopsy of a skin lesion. The correct answer is B. Biopsy of the lung. Minor office surgeries include skin biopsies, cyst removals, and suturing. Lung biopsies are complex procedures requiring advanced imaging or surgical facilities and are not performed in a standard medical office. Question 9. Heart sounds that are heard when the blood pressure is being measured are called A. Cord cough sounds, B. Rinne sounds, C. It snowing sounds, or D. Jaeger sounds. The correct answer is A. Cord cough sounds. Korokoff sounds are the rhythmic noises heard through a stethoscope as the blood pressure cuff is deflated, representing the flow of blood through the artery. Question 10. The popliteal pulse is located A. On the thumb side of the wrist. B. Behind the knee. C. On the dorsal surface of the foot. Or D. At the apex of the heart. The correct answer is B. Behind the knee. The popliteal artery is located in the popliteal fossa, which is the shallow depression located behind the knee joint. Question 11. The most important thing to do to prevent transfer of infectious material is A. Use biohazard bags. B. Dispose of sharps in a rigid container. C. Wash your hands. Or D. Disinfect patient care equipment between uses. The correct answer is C. Wash your hands. Hand hygiene is universally recognized as the single most effective method to reduce the transmission of healthcare-associated infections. Question 12. Which of the following types of urine specimen contains the greatest concentration of dissolved substances? A. Random. B. First voided morning. C. Clean catch midstream. Or D. 24-hour. The correct answer is B. First voided morning. First voided morning specimens are the most concentrated because the urine has stayed in the bladder overnight, making them ideal for pregnancy tests and protein screening. Question 13. When moving a heavy object, one should A. Bend from the waist to lift the object. B. Ask for help if an attempt to lift the object shows that it is too heavy. C. Make sure that the object is at least 5 inches away from the body. Or D. Assess the object prior to trying to lift it and ask for help if needed. The correct answer is D. Assess the object prior to trying to lift it and ask for help if needed. Proper body mechanics involve assessing the load first and asking for help or using mechanical aids for heavy objects to prevent musculoskeletal injuries. Question 14. When removing paper that is soiled with biohazardous waste from the exam table, the medical assistant should do which of the following before cleaning the table with disinfectant and pulling down unused paper? A. Use sterile gloves. B. Roll the paper inward and toward the body working from the end of the exam table. C. Gather the soiled paper in gloved hands and discard. Or D. Using unsterile gloves, roll the paper down toward the body and discard. To minimize exposure to biohazards, contaminated table paper should be rolled inward away from the body, discarded properly, and the medical assistant should then change gloves before proceeding. Question 15. In an infant, you should check the pulse in which of the following arteries in an emergency situation? A. Carotid. B. Radial. C. Brachial. Or D. Femoral. The correct answer is C. Brachial. The brachial artery, located on the inner aspect of the upper arm, is the preferred site for pulse checks during infant CPR as it is easier to palpate than the carotid in babies. Question 16. The generic name for Lipitor is A. Atenolol. B. Atorvastatin calcium. C. Clopidogrel bisulfate. Or D. Furosemide. The correct answer is B. Atorvastatin calcium. Lipitor is the brand name for atorvastatin, which belongs to the statin class of drugs used to lower cholesterol and prevent cardiovascular disease. Question 17. After a patient has had a grand mal seizure, one would expect the patient to be A. Confused and drowsy. B. Excited and hyperactive. C. Hypotensive with a decreased pulse. Or D. In need of airway management. The correct answer is A. Confused and drowsy. The postictal state following a grand mal, tonic-clonic, seizure is characterized by confusion, fatigue, and drowsiness as the brain recovers from the intense electrical activity. Question 18. The most appropriate position for a patient with respiratory problems is A. Trendelenburg. B. Fowler's. C. Lithotomy. Or D. Dorsal recumbent. The correct answer is B. Fowler's. Fowler's position, sitting up at a 45 to 60 degree angle, promotes maximum chest expansion and lung ventilation, making it the best position for patients with respiratory distress. Question 19. Which of the following is not a normal vein for phlebotomy? A. Cubital vein. B. Brachial vein. C. Hepatic vein. Or D. Cephalic vein. The correct answer is C. Hepatic vein. The hepatic vein carries blood from the liver to the heart and is deep within the abdomen, whereas the cephalic, basilic, and cubital veins are superficial and accessible for phlebotomy. Question 20. Which of the following situations would be of least concern when involved in a sterile procedure? A. Talking over the sterile field. B. Loose uncovered hair on a member of the sterile team. C. A non-sterile person entering the room. Or D. Adding non-sterile items to the sterile field. The correct answer is C. A non-sterile person entering the room. In a sterile procedure, maintaining the sterile field is critical. A non-sterile person entering the room is of least concern as long as they stay away from the sterile field and do not touch anything. Question 21. Draping is done primarily for A. Convenience of the doctor. B. Keeping the patient warm. C. Patient privacy. Or D. Convenience of the medical assistant. The correct answer is C. Patient privacy. Draping the patient during an examination is essential for maintaining patient privacy, modesty, and comfort, while only exposing the specific area to be examined. Question 22. To take the blood pressure correctly, the medical assistant should A. Use any blood pressure cuff that is available as long as it fits the patient's arm. B. Have the arm at or near the level of the heart. C. Pump up the cuff until the pulse is no longer audible. Or D. Release the air from the cuff rapidly in order to decrease patient discomfort. The correct answer is B. Have the arm at or near the level of the heart. For an accurate blood pressure reading, the patient's arm must be positioned at heart level. If the arm is too low, the reading will be falsely high. If too high, the reading will be falsely low. Question 23. A person who has difficulty breathing and experiences swelling of the respiratory tract following a bee sting may have A. A myocardial infarction. B. Anaphylactic shock. C. Obstructive airway disease. Or D. Cardiogenic shock. The correct answer is B. Anaphylactic shock. Anaphylactic shock is a severe, life-threatening systemic allergic reaction characterized by respiratory distress, swelling of the airway, and circulatory collapse. Question 24. Which of the following is not a true statement regarding tuberculin testing? A. A small amount of tubercle bacillus is administered intradermally. B. The results are read in 48 to 72 hours. C. Induration is a positive indicator of disease. Or D. A person who has been vaccinated with BCG will test positive. The correct answer is C. Induration is a positive indicator of disease. Induration, a hard, raised area, is the diagnostic indicator for a positive TB skin test, MANTO. It indicates exposure to the bacteria, but a chest X-ray is needed to confirm active disease. Question 25. Which one of the following is not a proper procedure for performing the Multistix 10 reagent strip test? A. Immediately recap the testing strip bottle. B. Do not touch the strip with your fingers. C. Hold the strip in a vertical position. Or D. Completely immerse the strip in the specimen. The correct answer is C. Hold the strip in a vertical position. When using reagent strips, Multistix, the strip should be held horizontally after dipping to prevent reagents from one pad from bleeding into another and causing inaccurate results. Question 26. Which type of thermometer should not be used in the medical office? A. Digital. B. Disposable. C. Glass. Or D. Infrared. The correct answer is C. Glass. Glass mercury thermometers are no longer recommended in medical offices due to the risk of breakage and the toxic nature of mercury. Question 27. Which of the following instruments would not be needed when preparing for a cyst removal? A. Scalpel. B. Needle holder. C. Send retractor. Or D. Dressing forceps. Cyst removal requires standard minor surgery tools like a scalpel, forceps, and needle holders. A speculum is used for viewing body orifices, like the vagina or ear, and is not needed for this skin procedure. Question 28. To encourage an elderly patient to give information while taking the patient history, the medical assistant should A. Ask questions that can be answered with yes or no answers. B. Interview a family member instead of the patient. C. Speak loudly because the patient is likely to be hard of hearing. Or D. Inform the patient in the beginning that there is only a short time to perform this history. Using open-ended questions allows the patient to describe symptoms in their own words, providing more detailed information than simple yes or no answers. Question 29. Urine or serum pregnancy tests are utilized to detect the presence of which of the following? A. Antidiuretic hormone ADH. B. Human growth hormone HGH. C. Heterophile antibody. Or D. Human chorionic gonadotropin hormone HCG. The correct answer is D. Human chorionic gonadotropin hormone HCG. HCG, human chorionic gonadotropin, is a hormone produced by the placenta during pregnancy and is the primary marker detected in urine and blood pregnancy tests. Question 30. The correct position to place a patient who has fainted is A. Prone. B. Trendelenburg. C. Lithotomy. Or D. Supine. The correct answer is D. Supine. The supine position, lying flat on the back, is the standard position for managing a patient who has fainted to help restore blood flow to the brain. Question 31. If a medical assistant is giving a 75-pound child a dose of antibiotic using Clark's law, which of the following would be administered if the usual adult dose is 500 milligrams? A. 500 milligrams. B. 250 milligrams. C. 200 milligrams. Or D. 125 milligrams. The correct answer is B. 250 milligrams. Clark's law uses the child's weight to calculate dosage. Child's weight / 150 x adult dose. For a 75-pound child, 75 / 150 x 500 milligrams equals 250 milligrams. Question 32. When performing an EKG on a patient, if the tracing is not what is expected, the first thing that should be checked is A. Placement of the electrodes. B. The status of the patient. C. Electrical interference. Or D. Machine settings. The correct answer is B. The status of the patient. Before troubleshooting technical issues like electrode placement or electrical interference, the medical assistant must first assess the patient's clinical status to ensure they are stable. Question 33. When performing a surgical hand scrub, make sure to A. Wash for 60 seconds. B. Hold fingers lower than the wrists. C. Dry hands with paper toweling. Or D. Hold fingers higher than the elbows. The correct answer is D. Hold fingers higher than the elbows. During a surgical scrub, the hands are kept higher than the elbows to allow water and soap to run from the cleanest area, the hands, down to the less clean area, the elbows. Question 34. Lyme disease, if untreated, can progress into A. Viral infection. B. Contagious disease. C. Chronic infection. Or D. Acute infection. The correct answer is C. Chronic infection. Lyme disease is caused by Borrelia burgdorferi. If not treated early with antibiotics, it can lead to chronic complications including arthritis, heart issues, and neurological problems. Question 35. Initial treatment for a sprained ankle would include A. Application of a heating pad in 20-minute intervals for the first 48 hours. B. Exercise the ankle in order to prevent stiffness. C. Application of ice in 20-minute intervals for the first 48 hours. Or D. Massage the ankle with pain relief ointment as needed. The correct answer is C. Application of ice in 20-minute intervals for the first 48 hours. The RICE protocol, rest, ice, compression, elevation, recommends applying ice in 20-minute intervals during the first 48 hours to reduce inflammation and swelling. Question 36. Which of the following reagent strip panels would show an abnormal finding if a person is suffering from a bacterial urinary tract infection? A. Plus glucose. B. Plus nitrites. C. Plus ketones. Or D. Plus bilirubin. The correct answer is B. Plus nitrites. Bacterial urinary tract infections, UTIs, often result in the presence of nitrites in the urine, as many gram-negative bacteria convert nitrate into nitrite. Question 37. To palpate the pulse in an adult, the usual procedure would be to A. Listen with a stethoscope at the apex of the heart. B. Feel at the inner aspect of the thumb side of the wrist with the first two fingers. C. Use the thumb of the dominant hand to feel the temple area of the skull. Or D. Located between the larynx and the sternocleidomastoid muscle in the side of the neck. The correct answer is B. Feel at the inner aspect of the thumb side of the wrist with the first two fingers. The radial pulse is located on the inner aspect of the wrist, on the thumb side, and is the most common site for checking the pulse in a conscious adult. Question 38. To have a method of checking to see if an autoclavate item is sterile, the medical assistant should A. Place indicator strips in the packs and envelopes and use autoclave tape to secure the packs. B. Set the timer on the autoclave to run for 30 minutes to ensure that the items are sterilized. C. Open one pack and check the indicator strip for sterilization after each autoclave batch is run. Or D. Leave an open flap in the packs to view the indicator strip to ensure that it is sterile. The correct answer is A. Place indicator strips in the packs and envelopes and use autoclave tape to secure the packs. Sterilization indicators, strips and tape, change color when exposed to specific temperatures and pressures, providing visual confirmation that the autoclave reached sterilization conditions. Question 39. In which of the following radiographic positions is the patient lying on their back? A. Prone. B. Supine. C. Oblique. Or D. Lateral. The correct answer is B. Supine. The supine position refers to a patient lying flat on their back, facing upward, which is common for various radiographic views. Question 40. Which of the following values is considered a desirable cholesterol level? A. 0 mg per dl. B. 180 mg per dl. C. 230 mg per dl. Or D. 250 mg per dl. The correct answer is B. 180 mg per dl. A total cholesterol level below 200 mg/dl is generally considered desirable for adults to maintain heart health. Question 41. Using sterile instruments to perform a breast biopsy is an example of A. Surgical asepsis. B. Sterilization. C. Medical asepsis. Or D. Personal protective equipment. The correct answer is A. Surgical asepsis. Surgical asepsis, or sterile technique, involves the use of sterile instruments and practices to keep an area completely free from all microorganisms. Question 42. Wearing a mask, gown and gloves when working with a patient is an example of using A. Barrier method. B. Standard procedure. C. Personal protective equipment. Or D. Body substance isolation. The correct answer is C. Personal protective equipment. Personal protective equipment, PPE, includes items like masks, gowns, and gloves designed to protect healthcare workers from exposure to infectious agents. Question 43. Applying an elastic or ACE wrap to a sprained ankle is an example of A. Bandaging. B. Applying a dressing. C. Splinting. Or D. Casting. The correct answer is A. Bandaging. Bandaging involves applying a material, like an elastic wrap, to support a joint, provide pressure, or hold a dressing in place. Question 44. Which one of the following is the correct angle for a needle to enter the vein for venipuncture? A. 5 degrees. B. 15 degrees. C. 30 degrees. Or D. 45 degrees. The correct answer is B. 15 degrees. For most venipuncture procedures using a vacuum tube system or syringe, a 15-degree angle of insertion is optimal for entering the vein without piercing through it. Question 45. Which of the following is a gram-positive coccyde that grows in clusters? A. Staphylococcus aureus. B. Neisseria meningitis. C. Mycobacterium tuberculosis. Or D. Escherichia coli. The correct answer is A. Staphylococcus aureus. Staphylococcus aureus is a common gram-positive bacterium that appears as spherical cocci arranged in grape-like clusters under a microscope. Question 46. A scraping of the superficial layer of skin is called an A. Abrasion, B. Avulsion, C. Laceration, or D. Incision? The correct answer is A. Abrasion. An abrasion is a superficial wound caused by friction or scraping against a rough surface, resulting in the removal of the top layers of the skin. Question 47. When preparing the skin for a minor surgical procedure, the medical assistant should A. Wash the skin with antiseptic soap in an up and down motion and using friction. B. Wash the skin with antiseptic soap from the inner area to the outer in a circular motion. C. Wash the skin with alcohol and air dry. Or D. Wash the skin with antiseptic soap after applying sterile gloves and gown. The correct answer is B. Wash the skin with antiseptic soap from the inner area to the outer in a circular motion. When prepping skin for surgery, cleaning in a circular motion from the center, surgical site, outward to the periphery ensures that contaminants are moved away from the sterile area. Question 48. Which one of the following diseases is confirmed by a positive VDRL and RPR? A. Hepatitis, B. Mononucleosis, C. Syphilis, or D. Rheumatoid arthritis? The correct answer is C. Syphilis. The VDRL, Venereal Disease Research Laboratory, and RPR, Rapid Plasma Reagin, tests are screening tests used to detect antibodies produced during a syphilis infection. Question 49. If the medical assistant notices a small tear in the sterile glove during a procedure, they should A. Put a piece of sterile tape over the hole in the glove. B. Alert the physician that they are not able to assist any longer. C. Ask a coworker to put on sterile gloves and take over. Or D. Continue the procedure but do not pick up sterile objects with that hand. If a sterile glove is punctured or torn, it is considered contaminated. The medical assistant must immediately stop, remove the gloves, and replace them with a new sterile pair. Question 50. Which of the following statements is true? A. A spirometer is used to measure the relative humidity of exhaled air. B. The specific gravity of urine is part of the microscopic examination of urine. C. The erythrocyte sedimentation rate is a means of identifying how fast blood clots. Or D. Hematocrit is expressed in section. Hemoglobin, Hb, measures the oxygen-carrying protein in red blood cells. It is measured in grams per deciliter, G/dl, whereas hematocrit is measured as a percentage.